When facing the challenge of addiction, one of the most pressing concerns for many families is the financial burden of treatment. It is a common barrier that can feel overwhelming, raising questions about how to access necessary care without incurring immense costs. The good news is, yes, in most cases, health insurance does pay for rehab programs. Federal laws now mandate that most health insurance plans, including those offered through employers and the marketplace, cover treatment for mental health and substance use disorders. This coverage is largely due to two important pieces of legislation: the Affordable Care Act, or ACA, and the Mental Health Parity and Addiction Equity Act, or MHPAEA. The ACA designated substance use disorder treatment as an essential health benefit, meaning most plans must cover it. The MHPAEA further ensures that benefits for mental health and substance use care are comparable to those for medical and surgical care. This means your insurance cannot place stricter limits on addiction treatment than on other medical procedures. However, the extent of coverage is not limitless and depends on several factors. These include the type of health insurance plan you have, such as a PPO or HMO, and its specific terms. Crucially, treatment must meet criteria for medical necessity, which means a healthcare professional must determine it is appropriate and essential for your condition. Coverage also varies based on the level of care, whether it is inpatient, outpatient, or a partial hospitalization program, as well as the duration of the program. Finally, whether a facility is in network or out of network with your provider can significantly impact your out-of-pocket expenses, with in-network options generally being more affordable. To understand what your plan specifically covers, it is best to contact your insurance provider directly. You can find their number on the back of your insurance card. Be prepared to ask about your deductible, co-payments, and out-of-pocket maximums for substance use disorder treatment. Additionally, inquire about any pre-authorization requirements for rehab facilities and ask for a list of in-network providers to maximize your benefits. When discussing coverage, you will likely encounter the term medical necessity. This refers to the clinical criteria used to determine if a service is appropriate and required. Another important concept is the continuum of care, which describes the different levels of treatment from detox to long-term aftercare. Understanding these terms can help you advocate for the most comprehensive coverage possible, ensuring a smooth transition between different stages of recovery. Many policies also feature case managers who can guide you through these processes. Ultimately, knowing that health insurance generally covers rehab programs offers a significant pathway to recovery. While the specifics requiring proactive investigation, your insurance policy is a powerful tool to access the vital support and treatment needed for overcoming addiction. By understanding your benefits and asking the right questions, you can navigate the path to healing with greater confidence and less financial stress.